Welcome to Instructions on File Configuration, Part 2. Here, we will start with learning how to configure the service delivery platform levels for analysis. We can click on the pencil button and rename existing delivery channels, as shown here in this example. Or we can also add additional custom delivery channels. Here, we will add a custom delivery channel at the bottom and name it as per our preference. Then click on the tick button. Then, we can move on to the next area, which is the Health System Administration levels. Here, you can rename any of the existing levels available, or you can also add any custom Health System Administration levels of your preference. We will show you an example of both here. Let's change the quantity of the levels available, or the units under each health system administrative level. You can choose the number of units available in your country, and as per the available data that you have. Here, we are selecting some custom levels, and then we are also adding a new administrative level, just to demonstrate the tool's capabilities. Once you are done, click on the Next button, and then move on to the different facility types and staff types. Here, you can review and edit the facility types to match the health system structure in the country for analysis. Please make sure that you assign each new facility type to one of the default facility types. You also need to map each facility to a service delivery platform. This allows the tool to pick up default data for your new custom platform and to calculate results tables at the end. You have the ability to rename the types of the facility or map them based on how the options provided in the drop-down menus below each category of facility. In this example, we will show you how to edit the facility types. We will show you the options available in the drop-down menus, and we will also show you that you can add a new facility type. Here, we are calling this new facility type Test Facility 1, which we are adding, and then we have to map it to the existing options available. We will choose the appropriate levels, and depending on the facility that we want to add, we will assign it to a specific delivery channel. Next, we will review and edit the staff types. You can rename the staff types, and you can also add new staff types. We will show you an example of both in this video. Here, you can see that we are adding a new staff type, and when we add a new staff type, we have to map it to one of the default categories for staff cadre that is provided in the drop-down menu. Once you are done, click on the Next button to move to the next category. Next, we will learn how to edit the program support and administration input prices. This is a set of standardized prices that will be used throughout the projection. You can rename any of these categories if you want to do so. You just have to click on the pencil button on the top right-hand corner of the file, and then click on Apply once you are done implementing the changes. Then, please go through each of the categories and provide an appropriate price according to the data available in your country. We have filled the sample file here for you to see how it should like once it has been filled out completely. You will see that we have certain standard categories available, and if you would like to add any new cost category or input, you can do so as well. Simply, click on the plus button in the right corner to add a new cost category like we show here, and then type the name of the category you want to add. After adding the cost category, you must also add cost inputs to the new categories added by you. Use the drop-down menu to add cost inputs, and you will see the Program Administration Cost table updated in real time. We will repeat this process for every cost category that is added. Once the categories and inputs have been added, you can input the values for cost in the table. After that, please click on Next to move to the Currency and Inflation section. In the Currency and Inflation section, first, you can choose to calculate all costs in the local currency, or US dollars. You can adjust the exchange rate between the local currency and the US dollar for the duration of the analysis. Similarly, you can move to the Inflation tab and adjust both the domestic and USD inflation rates. Once you modified the rates, click on the Move to Health Services tab to continue further with your data entry.